Okay, welcome everyone. So now we are going to look at the most important topic and highly recommended topics related to FCPS, and this is related to cardiology, aortic regurgitation. Clinical feature is diastolic murmur with weak radial pulse, and weak radial pulse is indicative of aortic regurgitation. Aortic regurgitation is also diastolic murmur, wide pulse pressure, and a hallmark of aortic regurgitation, and it has also increased left ventricular end-diastolic volume, and pulmonary edema can also lead to aortic regurgitation. Left ventricular end-diastolic volume will be increased. Blood pressure is 140 to 148. Early diastolic murmur. So here is a mnemonic for memorizing these type of the uh, clinical features: paid and pass. Now A stands for aortic, P stands for pulmonary, I stands for insufficiency. With it are always present with diastolic murmur. So aortic regurgitation present with a diastolic murmur. So from here you can look at the mnemonic. Aortic regurgitation, as I already mentioned, pulmonary or aortic regurgitation is always diastolic murmur. Mnemonic is PA, pulmonary aortic, I insufficiency, and D for diastolic murmur. So aortic regurgitation present with the diastolic murmur, and there may be left ventricular hypertrophy, known a cause of left ventricular hypertrophy, significant increase in diastolic volume of left ventricle, increased aortic pressure, and early diastolic murmur results into the aortic regurgitation. Aortic regurgitation has also water hammer pulse present, wide pulse, or severe aortic regurgitation is early diastolic murmur, and early diastolic murmur is clinical feature of aortic regurgitation. Increase preload, increase end-diastolic volume of left ventricular hypertrophy will be there, and increase end-diastolic volume of the left ventricle will be there in aortic regurgitation. Now, coming at the other clinical scenarios are pulmonary hypertension. Patient will have in pregnancy there will be exacerbation of the pulmonary hypertension and mitral stenosis. Women with mitral stenosis, 28 year of gestation, worsening dyspnea, that will be the pulmonary hypertension. Mitral valve prolapse, in which there is myxomatous degeneration, and myxomatous degeneration is common in mitral valve prolapse. Mid-diastolic murmur in a patient having increased PCWP. I don't know what is this name on for what a short form of pulmonary hypertension will be there. Left atrial hypertrophy. Now just understand the concept. This is heart, this is right side, this is left side. Left atrial hypertension is there, and patient has mid-diastolic murmur. So as I already mentioned the mnemonic, so this is regurgitation, and mid-diastolic murmur means mitral stenosis will be there. So mitral stenosis will be there, and it is mid-diastolic murmur represents mitral stenosis, and a pulmonary hypertension is also there, and hypertrophy is also there. So mitral stenosis results into the left atrial hypertrophy. Now other scenario is mid-diastolic murmur, left atria is hypertrophied, pulmonary hypertension, clinical triad of right ventricular hypertrophy. So right ventricular hypertrophy will be also there, and because of it there is chronic pressure overload in right ventricle, and when there is left ventricular hypertrophy, that is because of aortic regurgitation. Left ventricular hypertrophy, when there is right ventricular hypertrophy, that is because of chronic overload of right ventricular, and mitral stenosis will be there. So here in the left side of the heart mitral valve is present. When it is stenosed, then blood has to um, uh, create more pressure on pulmonary vasculature, and patient will have overload of right ventricle, that results into the right ventricular hypertrophy. Now 25-year-old female having shortness of breath, exertion, palpitation, chest pain with 130 by 90 blood pressure, systolic murmur is fourth intercostal space, that will be the a normal heart and symptom sign does not indicate any significant disease, because patient is also young in age, 25 years. Okay, so now looking at the patient with murmur and QRS complex has 180 plus axis deviation, that is right bundle branch block. Right bundle branch block in ECG finding includes axis deviation, and which is 180 plus axis deviation. Mitral valve prolapse most likely indicate mitral valve replacement. A severe mitral valve prolapse can necessitate the valve replacement. Mitral stenosis patient have loud S1 opening snap, mid-diastolic murmur, and right ventricular hypertrophy is also there. These auscultative signs include mitral stenosis. Okay, another clinical feature is ankylosing spondylitis, which is having presentation of the aortic insufficiency. Aortic valve disease can be associated with ankylosing spondylitis, in which there is the shortening of the space between vertebrae, and it results in the back pain. And the other presentation is machine-like murmur is present in the patent ductus arteriosus (PDA). 2-year-old child born with premature murmur congenital heart disease, they are prematurely increased risk of congenital heart disease. So these are some of the most important questions related to cardiology, which often repeated in the FCPS exam. So I wanted to share with you people. For more such videos, just follow me, hit the subscribe button, open the notification icon, and you will get to receive notifications on my every single video whenever I upload them. Thank you for